Beginning with this year's elections, voting gets a whole lot easier.
Your mailbox is your ballot box.
Your ballot packet comes to you in the mail.
But only if you're a registered voter. If you need to register or update your address, do it today at elections.hawaii.gov.
Look for your free Hawaii elections guide in the newspaper or at these locations statewide.
The deadline to register for the general election is October 5th, so don't delay.
Hawaii votes by mail.
And good morning. Happy Monday. It is October 5th here on Spotlight Hawaii. I'm Yunji Denise, joined by Ryan Kalei-Suji. October 5th means today is the last day for you to register to vote in the general election. The election's going to be here very soon, Ryan, and so people need to get out there, register to vote, make sure your voice is heard.
That's right. So we want to encourage everybody to head over to the elections website, elections.hawaii.gov. If you have not yet registered, you can again do that today. And therefore get more information about how you can make sure that your voice is heard in the upcoming election. Today, we, of course, have a very special guest, someone who is extremely busy during this time, but we certainly appreciate him taking the time to join us here. Governor David Ige joins us here on Spotlight Hawaii. Good morning, Governor. Great to see you.
Good morning. Thank you again for having me. I appreciate it.
Yeah, Governor, of course, a lot of attention being placed to right now the opening of Hawaii on October 15th, when that 72-hour pre-testing program gets launched and underway. There are some questions, of course, coming in about how the state will manage this. What are your thoughts heading in as we get closer to this October 15th deadline? Do you feel like the state is ready to open up transpacific travel on that date?
Yes, we continue to work and do the thousands of things that need to be done in order to open on October 15th. We've had a couple of iterations on the new digital platform, and we're making improvements to that virtually every single week, identifying areas that we can improve. And I'm confident that we'll be ready come October 15th.
There's a big article in today's paper about the restrictions that Mayor Caldwell has put in place, this 4-tiered system, and the concern that by allowing visitors in, even if they have very low virus, there will inevitably be some that do slip through the cracks and come here and are infected with COVID. So even if we do have a small percentage of those folks, that could knock us, if we are able to get to Tier 2, back down to Tier 1. And there's concerns about the economic implications of that. I know that the whole reason that we are doing this is to revive our economy, but do you worry that this could actually hurt us in a way if we're, tossed back to Tier 1 after finally achieving Tier 2?
Yes, I do believe that. You remember that the tiers are really defined by the volume of virus activity, and the state had worked very closely with the city and county of Honolulu to establish those tiers. And part of the reason for those tiers is the feeling that, at Tier 1, virus activity is out of control and is capable of increasing exponentially. Tier 2 is a more controlled environment that we believe will not overwhelm the healthcare system. And then Tier 3, obviously, is even less virus activity. So I think that the tiers are based on the science and what we know about the virus. And so certainly, I think what the mayor is trying to do is make sure that everybody's aware that these are the virus counts and the activity that we're seeing. We all have a part in keeping that virus count down by social distancing, by wearing our masks, doing all the things that we know work in keeping the virus infections down to a minimum.
In our last conversation that we had, we sort of talked about this. And of course, this was before the mayor announced sort of this tier system. And you had sort of talked about just your general thoughts about not only sticking to just numbers, but sort of like all the other factors that go into determining when to reopen and when to close. And you had mentioned that you're a little hesitant because you have to take in all these other considerations. This tier system does solely rely on sort of numbers. And do you think realistically with those numbers that we'll be able to get out of Tier 1? And do you think that the mayor should maybe consider other options and not strictly go by those numbers as you maybe had previously talked about before?
Ryan, I think the mayor, and just like we do get input from a lot of people, and people are saying, as a business person, how do I know what to expect? So the tier system and reporting the counts and really defining what the ranges are is really an effort to keep businesses informed. They can see where we are. They know what the boundaries are. More than 100 is tier 1. Tier 2 is from 100 to 75. So, as the virus counts come down, they can anticipate what's happening. I think that was the purpose and the reason that the mayor had developed this system. People can count. We'll stay in the same tier for 4 weeks. You can anticipate 2 weeks prior to that. If we are at the next tier, you can anticipate moving down to the lower tier. Obviously, the incubation cycle is 14 days, and we would not see any impact on the numbers until a reasonable time period expires.
Let's bring in Alexa's question. Alexa Lovell says, Inter-island traveling for Oahu residents, when can we travel without quarantine? There's a bunch of people asking about inter-island travel restrictions.
Yes, so as people might remember, the reason for putting in the inter-island quarantine is because the virus activity on the neighbor islands is significantly lower than the virus activity here on Oahu. And so neighbor island residents were concerned about people coming from Oahu or neighbor islanders coming to Oahu and being infected with the virus and then returning home to their islands. So that's why we do have the inter-island quarantine. I have been working with the mayors to identify, what the health metrics would be so that we can drop the inter-island quarantine. I do know, and when I talk with residents, especially on the neighbor islands, they continue to be concerned because of the number of virus cases they see on Oahu.
In sticking with this neighbor island quarantine period, as we open up on October 15th, there are some governors that are calling for an additional test. Some mayors that are calling for an additional testing, second testing, if you will, when you arrive on their island. What is sort of the status of that? We know that they have sort of put in that request and they have spoken to you about that. What are your thoughts about this additional testing? Do you think that's realistic? And do you think that might be confusing for those coming into the state, knowing that if they go to a different island, there's going to be a different set of rules?
Yes, Ryan, I have been working with the mayors. In a perfect world where we had unlimited access to tests, I think that having a second test would make sense. But just a reminder, typically we test between 2,000 and 3,000 people a day. Basically, people who are symptomatic, close contacts, people who have been exposed. So only those high priority people that we believe should be tested because of the risks that they present. If we get 2,000 additional visitors, we would exhaust the local capacity pretty quickly. And that's the concern that I have. If we had unlimited tests, we could consider a second test. Right now, based on the testing capacity that we have available to us in the state. And remember, we got to be able to test it here in the state. If we have to send that sample to the mainland, there's a 3 week delay, and it would not be helpful for us in terms of managing the virus. So, I think that's the considerations. We want to be clear to those visitors who we are inviting that the pre-travel test means that you would not be subject to quarantine. And that's what the program will be.
So I just want to make sure that I'm clear on how this will work. Let's say I'm in California and I decide I want to go to visit Maui. So, but I don't know if and forgive me, I don't know the flights right now, but let's say you have to fly through Oahu. Let's say the Hawaiian Airlines flight that usually flies direct is not operational. Does my 72-hour test then clear me to travel to Maui, or do I have to stay on Oahu and get how does this actually work if I'm on the mainland and I want to visit a neighbor island?
So certainly what would happen is you would need to be able to get a negative test 72 hours prior to your travel, your last leg from out of state into the state of Hawaii. And if you got a negative test, then you would not be subject to quarantine. So if you happen to fly into Oahu, do a layover and get on the flight in the next available flight to Maui, then that would all be part of the same trip. If you are flying in directly to Oahu, get off the plane, spend a day or so here, then that doesn't translate. You could come to Oahu and not be subject to quarantine. But if you then take an inter-island flight, you would be subject to quarantine again.
Another question that we had was just with the overall testing system. Is there any sort of mechanism or system that's being set up to track those that are taking this pre-travel testing before coming to Hawaii? So let's say a Hawaii resident visits the mainland. They want to come back home, they take a test, but they test positive. But instead of having to stay on the mainland for 14 days to heal and get better on the mainland, they decide, you know what, I'm not going to report it. I'm just going to get on a flight, come back to Hawaii, and not report my testing and do the 14-day quarantine. Is there a way to sort of monitor who's taking these tests and the results that are coming in so that they're sort of not this selective reporting of their test results?
Just so a couple things, Ryan. It is dependent on self-reporting, right? What would happen now if you want to participate with this pre-travel testing program? You would sign up when you probably make your airline reservation. You know what time your flight departs to Hawaii, so you can figure out what 72 hours prior to that is and get the test done. Once you get the result, then if it's negative, you can upload it into the system. And when you arrived in Hawaii, you would not be subject to quarantine. If you got a positive result, the airline probably wouldn't let you fly. So, at least all the airlines have canceled cancellation fees and rescheduling fees. And so hopefully you would just not come. You could not inform anybody and get on a plane. And if nobody knew about it, then you could probably get here to Hawaii and you would be subject to quarantine because you completed the forms. We know you're coming in. We didn't get a negative test. And all of those who we don't get the negative test for is subject to quarantine when they arrive here in the islands.
We're still getting a lot of questions about this whole inter-island and really the timeline for local residents, people who want to go see family on the neighbor islands or people who want to travel back and forth from the neighbor island and then back home. Do you have a time frame for when you are going to make a decision? And also, will this be done island by island? In other words, if Mayor Kawakami decides that they're not comfortable with doing it on Kauai, but Mayor Victorino says, you know what, Maui is okay with this. I mean, how are you making this determination?
I am working with the mayors and we'll be talking about it again today. And we'll be announcing the final details by midweek this week. So everyone would know. I know that there is proposals about follow-on testing. And as I said, we'll be working through all of those details and making announcements later on this week.
Another question, of course, that comes up is just the unemployment problems that were happening, the backlog. We know that there has been a new hotline that has been set up. We are getting some reports of people saying that they haven't been able to get through. Can you provide any sort of update on the call center that has been stood up by the department, by the unemployment offices, and how that is going right now?
Yes, the call center is operational, and I know that they are expanding. We did contract for 200 people in the call center. We have asked them to make an effort to hire local people because we find that would be helpful. So I know that the call center is operational, and for those who are on the calls, they are trained and they are able to adjudicate claims. As I told you last week, we've already processed, and I checked the numbers today, more than 96% of the applications made have already been processed. Those that have been cleared are receiving payments. That last 4% are adjudicated claims. So there's a discrepancy. Someone needs to listen to both sides of the story and then really make a decision about whether someone is entitled to or is not entitled to benefits. And those are the claims that we're working through. In addition to just the call center, we also will be hiring 100 adjudicators. So they're attorneys that are trained in dispute resolution and are very familiar with unemployment law. And they'll be going through those remaining 4% of the cases and then getting more information and making decisions to clear those cases. So, I will be providing another update. Call center just started last week. So, we're working through the process of ramping that up, and I'll give you guys statistics when I get them.
There are some questions here. Tom Sawchuk wants to know, is there pre-testing for international arrivals as well? Early on, we've been talking about possibly doing travel bubbles with Australia, Japan, other countries that have low virus. Are they part of the October 15th plan as well, or is that just for domestic travel?
The October 15th is primarily for domestic travel. We are working with the consul generals here in the islands. For example, I do know that we've met with the Japanese officials, for example, and we've identified what the equivalent test would be, and we've identified the testing partners in Japan who would be able to take the samples and conduct the test that would be the equivalent to what we're asking for from U.S. travelers. So we continue to work with the government in Japan, and hopefully we'll be able to see flights from Japan with the pre-travel testing program. We continue to work with South Korea, and there's been a strong interest presented from Taiwan as well. And so we continue to work with that. We'll be making announcements on the international programs and partners as we work on the details.
Aside from just the, of course, opening of Hawaii to trans-Pacific travel, there's a lot of concern about local businesses right now and their just ability to make it during this time. Paul has a question. Does the state foresee providing more monetary relief to businesses that have been closed from the second shutdown? The $10,000 in CARES Act funds is not enough for most businesses to survive. Over 10% of Hawaii businesses have permanently closed, and more to follow without sufficient relief. Is there anything in the works to sort of help some of these businesses? We know some of these initiatives and programs and state funding has been allocated to some of these businesses, but they continue to say that they need support. Is there anything in the works or plans right now to maybe provide further assistance for some of these smaller businesses?
Ryan, we have been working, we've met with the Chamber of Commerce and the Business Roundtable and looking at how we would structure programs that provide business relief. Our primary mechanism of supporting small businesses is to really work with the counties. And so we've talked with City and County of Honolulu, as well as all the neighbor island counties, and they've stood up business relief programs, and we are finding out whether they have more applications than they can provide support, and seeing what additional funds we have available. As you know, people have been encouraging me to get the money out as quickly as possible. So we've pretty much allocated all of the funds that we have. And so what we're doing now is just monitoring the progress in those programs. As we talked about last week, we have $100 million for rent and mortgage relief, working with the nonprofits and really seeing how many people are in need and how quickly they can get the funds out. So if we do have programs that we've allocated more money than they can spend, then we would be able to reallocate those funds into business support programs. But it's really hard to start a program up from scratch. And so we will be going through the county relief programs as the best mechanism to get money into the community.
And on that same topic, just sort of on the COVID-19 response generally, your office did share a graphic with us that we wanted to put up and give you a chance to talk about, which is sort of the overall pandemic action plans and the top 3 priorities for your office. Can you tell us a little bit about that? And Ryan, if you wouldn't mind calling that up there.
Yeah, certainly. Thanks for sharing the graphic. We are seeing more government and private sector community people just really coming up and stepping up to really be involved and help out with our COVID-19 response. So our pandemic action plan has 3 priorities. First is to protect public health, and we're doing that in increasing testing and contact tracing. We're working on the vaccination plans and really encouraging people to do the things that we know work, protect the public health, wear your mask, stay home when you're sick, wash your hands, maintain 6 feet of distance. Second priority really is to revive the economy. I know we've talked about it. We are looking at reopening and restarting travel. We know that many businesses do count on that. The counties and the mayors are reopening additional activities as we see the virus counts drop. So we are focused on reviving the economy. And then the third priority is really about strengthening our community. How do we provide support? The rental and mortgage relief is part of that. Business relief is also part of that, and providing other kinds of programs. That's the three priorities we're focused on. We are making progress, and it really has been an all of community response. And we're just very thankful for everyone being willing to come forward and help.
One of those efforts that sort of is geared towards helping, of course, those businesses is a program that you folks announced last week with the Hawaii Restaurant Card. It made national news, of course, this new program that you are sort of implementing. When can households and people expect to start receiving those cards? And what are some of the stipulations behind that? Is it per household? Is it per person who qualifies for unemployment benefits? If you can provide any other further detail about when people can start expecting to see it and what to expect when they get that.
Yes, Ryan, we are taking the list of all of those who are eligible to receive unemployment benefits, both PUA as well as regular unemployment. And we will be mailing the cards out, and they should begin to receive them the week of October 15th. So we ask people to look out for the card. If you are receiving unemployment benefits or PUA benefits, then please look out for the card. It would allow for $500 of purchases from our local restaurants. And we are trying to support the restaurants. And many of them are just small businesses. I know that they've been impacted by, many had to close their dining rooms and are just getting started at reopening dining rooms after being focused on takeout only. So we do think that that's a win-win. It'll help those who are unemployed. At the same time, it'll really help our local restaurants.
I want to ask you, sort of shifting gears a little bit before you go this morning, if you could tell us about what's happening in Hilo. This is now a second care home with what looks to be a pretty severe coronavirus outbreak. Obviously, these are the people who are at the most high risk. What is being done proactively, not only for the care homes on Hawaii Island, but throughout the state, so that we don't see a repeat of what's been happening there?
We always knew that care homes would be a high priority area, and we've implemented programs. We have been working with the Healthcare Association of Hawaii that represents all of the care homes and implemented all of the recommended actions. They shut down visitors. They've been taking proactive measures to contain infection. We did, working with the Federal Department of Health and Human Services, distribute point-of-care testing units to every single licensed by Medicare and Medicaid nursing home in the state. So they actually have point-of-care testing units. They were delivered before the end of September, and now they can acquire additional test kits, and they can implement a program of regularly testing residents as well as staff at every care home here in the state of Hawaii. So, again, it's unfortunate that they do have that outbreak in that Hilo care facility now. We do have Department of Health personnel consulting with the administration of the care home. We're providing support for testing and guidance about implementing infection control measures. Our care home industry has really responded to this virus outbreak pretty well compared to national averages. It's unfortunate that we've had these two facilities on Hilo that have had outbreaks within the residents at those facilities.
Well, we want to bring in another question. This is a pretty specific one, but I think it bodes to a wider question in general as well. Nicole Garcia is watching from Honokaa, says, would you consider negative testing as an option for resident UH students who need to travel to the neighbor islands? What would you say maybe about this situation, but also in general to those who are maybe seeking exemptions? Is that something that they need to be done per island, or is that the state overall that has to make those sorts of exemptions for maybe, say, a UH student or anyone that's looking to travel? What does sort of that process look like, and would something like this be factored into a consideration?
You know, Ryan, there are specific businesses that are exempt and specific essential activities and essential workers who are exempt statewide. But the inter-island quarantine has been implemented on a county by county basis. So, you know, I would just, if she is traveling to several neighbor islands, she would have to make that request into the different islands. We have been working to standardize most of that, but each county has implemented a little differently. We continue to work to make sure that we can share notes and come up with those instances where there may be differences from county to county. But clearly, if she is going on as part of her work program or her studies, she can seek an exemption and should do it prior to arriving in each county.
Okay, I know our time is wrapping up, and we don't want to keep you from your meeting with the county mayors, but you know, we're 10 days away from opening Trans-Pacific travel. I guess bottom line before you go, are we ready?
You know, I do believe we're ready, and we're getting better and more prepared as we speak. You know, the digital platform is helping us. We are implementing and automating more of the activities to keep track of people once they come into the islands. We are working with the counties to do a better job of enforcement of quarantine, because we know that that will be an important part of this new program. And we do believe that we won't see a real big initial surge in the visitors who come here, but we hope that we can slowly revive our economy by bringing visitors, trans-Pacific visitors, back to the islands.
All right, Governor David Ige, thank you very much. We know that you're a busy man and have a lot on your schedule, but we appreciate you taking the time to sort of take some of the questions from our viewers, as well as update us on the efforts that you and the state are undertaking right now. So thank you, and we'll look forward to seeing you again.
Yeah, thank you. Aloha.
Thank you. Well, interesting to see, and we see a lot of you logging in, wondering about this neighbor island travel. Ryan, that really seemed to be a focus of a lot of the questions today. Of course, the governor is leaving this chat, and he's heading straight to a meeting with the neighbor island mayors or the county mayors. I'd assume that Mayor Caldwell will be there as well. And, you know, they haven't figured out exactly what they're doing, or perhaps they have, but they haven't announced it yet. But he did say they will be making an announcement midweek. And it is interesting. So if, like we laid out that example, if you're coming from the mainland and you want to go to Maui, if you don't get off the plane, if that's considered one leg, even if you do have, let's say, a stopover here, as long as you stay at the airport, your test, your pre-travel test, will count as clearance there. But if you get off the plane and you spend a few days on Oahu, or even just one day, you are still subject to that 14-day quarantine as it stands now. Of course, that could all change when they make an announcement later this week.
Yeah, so we could be looking at some counties initiating a second testing option for those coming and looking to bypass that quarantine period. But the governor really making it clear that the state of Hawaii just simply does not have the capacity at this point in time to add a second testing for those who are arriving in the state. So, you know, aside from, of course, the pre-test that they have to take, the state at this point in time cannot sort of allow for an additional test just because of testing capacity. He says at some point they hope, of course, to be able to offer that and to be able to institute that. But at this point in time right now, it just simply is not in the capacity of the state. Also, you know, we want to note that there are some people asking about, of course, headlines over the weekend. The president has been, of course, announced that he has been infected with COVID-19, has been in the hospital during this past weekend. The governor, we spoke to him right before we sort of went live. He has not necessarily had any conversations with the White House about this, sort of the president being in the hospital, or really has not really received any correspondence with the White House thus far.
That's right. And a lot of you also asking about the current restrictions on Oahu, asking about gyms, restaurants, and whatnot. We are going straight to the source on Wednesday this week. We will be talking to Mayor Kirk Caldwell, so we invite you all to come back and join that discussion. We know that you have a lot of questions about the 4-tiered system. We haven't had him on since that was announced, so we are very excited to bring him on Wednesday. And we'll be talking to him about transpacific travel because, as noted in the paper today, it will not take all that many cases to perhaps knock our numbers back to a tier 1 situation. And so it could be very restrictive for a lot of businesses if we have an influx of visitors with COVID-19. So we look forward to talking to the mayor on Wednesday. And then on Friday, we've invited John DeFries. He, of course, is the new head of the Hawaii Tourism Authority. He will be very instrumental in this new program of free testing, and also how do we market Hawaii going forward? What does tourism look like? We'll be breaking all of that down with him on Friday.
That's right. And of course, he will play a critical role as Hawaii begins to reopen and the tourism industry starts up again. He has just been announced into this position, so we'll talk to him about his transition into that role as well as his plans moving forward. So again, a busy week ahead for us here, and we certainly appreciate all the comments. Of course, the mayor, the governors always seem to get a lot of comments. We try our best to get in some of these specific questions, but we try to summarize them as best as we can so that we can get more broader topics. But we certainly appreciate all of these questions and comments that come in, and we will continue to try our best to get the information out to all of you. Again, reminder that today is the final day to register. If you have not yet registered for the upcoming election, you can again head over to their website to make sure that you're registered.
Yeah, that's right. Today is the last day. And lastly, a lot of you asking unemployment questions. We have invited the head of the unemployment office. She's going to be joining us later this month, so you can save those questions for her. We know a lot of you are frustrated with the system, but hopefully the new call center that they did stand up last week is helping to resolve some of those issues. But Ryan is right to note, today is October 5th. We've been talking about it for a long time, and today is the day. It is the last day to register to vote in the election. Remember, it is all mail-in ballot this time around, just like the primary. And so we hope to see you participating in this year's election.
That's right. So again, we want to thank our sponsor, of course, the Office of Election, and encourage all of you to tune in here on Wednesday at 10:30, where we'll be talking with Honolulu Mayor Kirk Caldwell. Until then, stay safe and aloha.
Aloha.